All right. Well, hopefully everyone got warmed up a little bit, got those brains going, got some good practice in with that. So we're going to transition into this is more of a panel discussion. Okay. I'll have our three speakers, three panelists introduce themselves in just a minute. But we came up with a series of questions, but if you guys have specific questions for any of them, you guys raise your hand and we can have you guys ask them. We don't have to go with the questions that I asked, okay? Does that sound good? So we're gonna start with Saulius and then just go down the line and you guys, if you just introduce yourself and just where you're from, a little bit your background with MSK Ultrasound.
Hello, I'm Musculoskeletal from Lithuania. I'm a radiologist and I'm doing MSK Ultrasound almost 15 years. And nowadays I'm doing only MSK Ultrasound. So I'm a fan of this diagnostic imaging and I'm happy to be here.
Sounds great.
My name is Zanta. I worked here previously up until 3 years ago. I'm currently at the Children's Hospital in Philadelphia, and I split my time between pediatrics at SHOP and I do adult MSK imaging at Penn. I've been doing MSK ultrasound, I guess, I'm saying 15, 16 years. I learned it from Ron Adler. Started the MSK ultrasound program in Michigan, followed by HSS in New York, and then at NYU at the moment.
Hello everyone, my name is Zoran Filipovic. I came from Croatia. I'm a physiotherapist and actually sonographer, and I'm teaching them skills for the past 10 years worldwide. And I have also been on a lot of conferences and courses around the world with the world-known speakers as I don't know, Martinoli, John Jacobson, and so on. So learning from a lot of people, a lot of very experienced tutors. And as I said, for the last 10 years, I am teaching them still mostly in my region, but also worldwide. So I'm very happy to be here and I'm very happy to share my knowledge with you. So feel free to ask them.
So all three of them have taught MSK ultrasound around the globe. So they have some different unique perspectives. So I'll start with one question. You guys think of other questions you may want to ask them. Let's see. All right, so asking about indications for pediatric MSK ultrasound. Are they differ in the US versus other countries? So what are some of the indications for pediatric MSK ultrasound?
It's a very broad question because I'm happy that I'm a radiologist and in my region, usually it's the patient for scanning, for MSK scanning, they can come to it with any reason. It's not only to have pain, any joint area, it's not just to have some lump or asymmetry of the ankles, etc. So the first step, of course, every time is X-ray, but the second is ultrasound. And I'm happy that's I mentioned it in my region that we're doing. And after my examination, I can just send or just suggest for the patient to do MRI or CT, etc. Yeah, there are many indications. Could be DDH, of course, but trauma, pain, lumps, yeah, anything. So.
Yeah, there's.
All right, so I over the past 3 years, I've done quite a bit of outreach work in Africa, particularly Ethiopia, and it's a resource limited environment between the two university hospitals and the capital in Addis Ababa. They have one MR, and the population of Ethiopia is about 120 million. So ultrasound is essentially one of the few resources that they have plentiful of. They don't necessarily have a lot of the equipment we do in the U.S. They get it mostly from China because it's a bit cheaper, but they use it for everything. And I think they're really phenomenal at MSK ultrasound. Now, to my surprise, I went there to teach them, and a lot of their radiology residents in particular were already fairly advanced when you compare to the our residents here in the US. So I think between X-ray and ultrasound, they can diagnose quite a bit of things, particularly sports injuries and GIA in kids. So I think in Africa they're using it for everything.
Yes, I must say that when we talk about ultrasound, especially the pediatrics ultrasound, I think that most of medical staff, they don't realize what we can do with the ultrasound. And this is the main problem. That's why they don't believe too much in ultrasound, because they don't know the possibilities of ultrasound. And also the conferences like this, we want to change that because I think that ultrasound can do much more than people can even think about. So it's very important to learn them what we can do with the ultrasound, and then they will prefer more for the ultrasounds. This is the first thing that we have to do in the future, because the ultrasound is actually very young diagnostic. How would I say it? It's very young in diagnostics, especially the MSK. We have done ultrasound for years in other parts of the medicine, but for MSK, it's very young actually. For the last 10 years, we have done booms with ultrasound, and this is good for the future. And with the new systems, new technology, we can see much better and much more. And I would say that first thing is education, to be able to do that, and after that, the indications are going to come with you. So in my region, for example, indications for ultrasound, not so much in pediatrics, because I don't think that in my region they do so much difference between the pediatric and the adult ultrasound in the MSK. But as also my colleague said, is especially in sport medicine. So in sport medicine, the injuries, all kinds of injuries, they refer to the ultrasound. So it's mostly.
Any questions from you guys?
Yeah, thank you all for joining the panel. I'm a beginner, but I'm curious if ultrasound can be used as a substitute for MRI. You mentioned resource limitation, but can you use it to help characterize things like OCDs, for instance, and a child might otherwise need anesthesia for their MRI? Like, do you think that it's reliable enough to be able to distinguish between different severities of an entity like an OCD, for example?
Repeat
I think OCDs would be difficult. I think that's one of the things I'll talk about in my introductory talk. You have to sort of, as a radiologist, we look at the X-rays, we look at MR, we look at the clinical history that the referring physicians give us, and you have to also, besides getting really good at scanning and learning anatomy, you have to really know where to apply ultrasound. I think OCDs is one where you can see it, but you cannot characterize it in enough detail for it to be useful for management. And in the US in particular, one of the struggles with MSK ultrasound for the radiologist is, well, this couple. One, MR generates more revenue for the hospital, so there's incentives for everyone to do more MR. And then second, you have to be good enough and consistent enough and reliable for your surgeons to act on your ultrasound findings. So that comes with time and building rapport and getting comfortable with your surgeons. So there are some challenges as well. It's not the answer for everything. So OCD maybe MR, I would say in my experience, is better.
On that same note, can you elaborate on what sports injuries you do find it really?
Sports injuries. Oh, so I have needs coming many let's say sportsmen and pediatric, probably pediatric patients and adults, but I think that ultrasound should be the first choice when you're dealing with a sport injury, and you can see like the same injuries of the muscles and the tendons. You can compare with MRI, you can follow them, etc. So in the good hands, it's enough ultrasound. But in those cases, when you see nothing and there's a complex, of course, you can refer for the MRI. But I would suggest every time just start for this ultrasound to any injury, any trauma. And even those cases, if you see nothing, it's also diagnosis. Yeah, it's can be relaxed for the sportsman and etc. In those cases, it's more like psychotherapy to the patient.
Let me say something. Yeah, with sports injuries, usually the children come with parents, and they usually had some injury, right? So usually something happened. So then you just try to scan this area and see what happens. Usually they fall or they feel something when they were running or whatever in the game, and then just scanning this area, you can see what kind of injury was that, or as Lou said, you don't see anything. This is also the diagnosis. Sometimes you're not going to see the big problem over there, but also you can see some chronic stuff, something like, I don't know, shoulder or something like that. So you can see a lot of things that you can diagnose with ultrasound, and you don't need any other images to do.
Specific example would be cuff tears. I mean, you don't see those in kids, but in adults, ultrasound's better. I think higher resolution for cuff tears than MR. So we have a pretty robust, diagnostic ultrasound practice on the adult side, and those patients go straight from the ultrasound to surgery. They don't need an MR. And so that's really the point you want to get to, because you're doing an ultrasound and then your surgeon's getting an MRI. So it's a big waste of resources and a waste of time for everyone involved. So, and then I think dynamic issues, because a lot of sports injuries are dynamic problems. And the best thing about ultrasound is you can do dynamic testing. So things like, small tendon tears in the fingers, for example, or pulley injuries, those are all things that you can diagnose better with ultrasound. There are MR methods for doing dynamic evaluation of joints. They're not really well established, and they're mostly in the research setting.
I put another question up there. How do training and certification requirements for pediatric MSK ultrasound differ? What are they based upon where you've been or where you practice?
Yeah, well, I'm saying in my region we don't have. Actually, this is the first conference in pediatrics that I know in the world, because I don't think that we have conferences like that in MSK ultrasound, and this is very good. So it's very important to talk about pediatrics also, and about usement of the ultrasound in pediatrics. So I don't think that we have something that is in my region that is especially for the pediatric MSK ultrasound. It's usually the MSK ultrasound, and then I use it in pediatrics. So I don't think that kind of education is available in my region. Of course, if you are doing some, if you work in church in hospital, then you will have the background, and you will have some more information about that kind of patients. But I don't see courses or something like that in pediatrics.
And there's a problematic issue with this training, because I'm also interested in MSK field, pediatric MSK field, almost 10 years, and I've been member of SPR, European Pediatric Society. I went there many times to the conference. It was a one search for the training. I'm also have been here in the United States, in the National Children's Hospital in Ohio, in Columbus. Just spent for 6 weeks, and But I mean that you must search anywhere, the workshops, the seminars, the webinars, it's not that easy. But for ultrasound, I'm also can advise just to go to the adults MSK ultrasound seminar dedicated, because I don't think so that pediatric scanning protocols should be separated or should be something else than adults. Because when I'm scanning the pediatric patients, I'm using the same protocols, and I think that they are good because trying to see the same structures and the pathology, almost the same ear, the same fluids, the noses, etc. So if it's possible, just at the beginning, just if you can go to the for the MSK, if it's for the adults and or dedicated for the adults. And yeah, this would be a good start.
Think about this. I think in the US, you know, I did my radiology residency at University of Texas in San Antonio. And most residency programs for radiology, ultrasound is part of the curriculum. And the ultrasound is a very small part of that curriculum. They do more body imaging, but you learn the basics, the foundations during residency training, and then depending on where you do your musculoskeletal fellowship, MSK ultrasound is built into those. But we learn to do ultrasound in a very sort of a systemic way, at least MSK ultrasound. You know, you have a checklist. So if I'm looking at the elbow, for example, you look at it by compartment. So if if the patient comes in with a medial compartment, there's a medial elbow pain. I'll look at certain structures in the medial part of the elbow and look at them all in a very consistent search pattern. And overseas, even though people tend to be really good with ultrasound, they tend to be more point of care type. They essentially focus on the structure that they're already expecting to be injured. And so I'd see that a lot more where they're essentially not following a consistent search pattern, but if the kid's coming in with a medial elbow pain, they're going directly to look at the UCL and ignoring the common flexor tendon, for example, or ignoring the medial joint. But I think to get really good at MSK ultrasound, you have to have a checklist for each joint, and you have to follow it consistently.
And there's also, you can check SSDR, European Musculoskeletal Society website. There are provided 6 main protocols. Of course, they're dedicated to the adults, but it's also just could be beginning for you, but to scan. And my other advice, every time you should do the same protocol, not concentrate only into one region, painful region, because sometimes you can find the pathology on other sides. So what I'm doing, I'm suggesting to do every time the same protocol, every time the same structures, because in that case you will learn more anatomy, you will be more skilled how to recognize even the more structures, and you can put in your brain how to look like normogram, normal ultrasound image. As much patient you have, you will more have experience in that.
That website.
And SSR, European Musculoskeletal Radiology Society. There's ultrasound subcommittee. How to say, not website, but page where you will find those protocols.
Yeah, but most courses also do this protocols. So the protocols are here to help us. Actually, it's a checklist, as always said, and when doing ultrasound, it's very advisable to do the protocols. So it's important because you're not going to miss anything if you follow the protocols, and that is important. You can miss the diagnosis, but you shouldn't miss the protocol. So the protocols are here to help you and for you, and this is important because doing ultrasound without protocols is not advisable, especially the MSK.
Doctor, I'll try. Musculoskeletal. Okay.
It's like muscle.
All right. You mentioned, I think it's great just to keep going to adult conferences. Do you have some conferences that you all would recommend, since it sounds like you all make the rounds in teaching?
Yes, sir. I belong to the SCCR, the Social Committee, and we are organizing next year in France, in Toulouse. There will be, well, it's a pity that they are organizing only one day, MSK ultrasound, but it's every time spread course to after that, there will be MSK radiologists, just mostly theoretically, but SSER. Then what we are organizing next year, SER, European Radiology Society, and in March in Vienna, there also will be a possibility to scan, to learn how to scan. Yeah, what else? I know MUSOC, there's also famous, mostly here in the United States, but also there a group of professors who are traveling around the world every year. Yeah, those start from them. And also there are so many other schools who are providing the teaching, but I don't know. There are many. I would say start from the how to say, or yeah, from bigger companies, from bigger organizations, because they are providing you the best quality for how to teach, how to recognize, etc., how to learn the protocols, and you will have more answers.
And I think that what is important to say, it's a lifelong learning curve. So if you go to one course, for example, which is for 6-7 days or whatever, you have to realize that on the 10th day, you're not going to be, it takes time. It takes time for learning, and it's not easy, but it's fun. Yeah.
Yeah, it's talking about the path. I started from the shoulder and knee. It took me 2 years to learn, and after that, I decided to learn ankle. The third year, all year I stand up to the ankle, then elbow, then wrist, and the last was the hip region. So, and only after that, I ended up with nerves. So it took me, I don't know, 6-7 years just to become an expert in that field, that you, not the expert, but you feel comfortable that you know what you're scanning, and that you're making diagnosis in that. So it's at least 6-7 years. Yeah.
It's also the Society of Skeletal Radiology, and the two oldest MSK societies, that's the national one. That's in Santa Fe in New Mexico. It's in March, and then next year the International Skeletal Society also has an ultrasound course, and so that's in Lisbon and next year. So those two are really the biggest MSK radiology societies, and they have every annual meeting, a couple of days they're spent teaching ultrasound.
Yeah, I have a question for Dr. Hamza. So you said that you've had other different types of ultrasound machines because they were cheaper.
No, not maybe. I think in the US we don't have problem getting stuff because I'm not buying it. But no, it's we're talking about my outreach trips in Africa. They get a lot of equipment that's not going to be familiar to us because it's coming from other parts of the world. It's cheaper for them.
So my question is so I know with AI and everything that's changing, I know, for example, like Clarence, they're trying to produce an ultrasound machine that has, I guess when you're scanning, it shows you, it annotates each muscle that you're at. So I'm just wondering, like, is that something that you've seen before?
Yeah, I think there's a lot of those sort of tools. I think that so getting a nice ultrasound machine is one part of the equation, and then getting like service and maintenance on those is another part. So, but yeah, there are a lot of AI tools coming out, especially for point of care kind of stuff. The really cool thing I've seen recently is for developmental dysplasia of the hips. There was a group in North Carolina. I'm not sure exactly where the software is coming from, but they can, if you're an RGT or a PCP and you have an ultrasound machine, this software will at least sort of guide you with giving you the probability of the kid having PAH, and so they can sort of guide your referral patterns to orthopedics. So that kind of stuff I think is really useful. It would take a long time for someone who's really busy, as a PCP or urgent care to learn ultrasound, but if you have an AI tool that can just stratify things for you, I think it's really quite useful. So there's a lot of those sort of come up very development, and we'll probably start seeing this.
I've been working with a lot of systems around the world and a lot of different companies and so on. And there are very cheap systems that can produce good pictures, and there are very expensive systems that cannot produce good picture. So it's very difficult to say which system is the best one. No, there are no best systems. There is the best system for you. I always advise people try the system. So take the system for you and try to scan it, and then you will see if the system fits with you. And always advise, do not buy the system before came to the course, came to the conference. Go buy it after, because there are a lot of people before the courses. They come to the course and they said, well, you know, I bought the system, I bought a small system, which is a wireless transmission with the tablets. They're very popular right now. But very soon they realize that this is not maybe going to be good enough for them, because it cannot produce so many details that you need. So first try to learn the ultrasound, start with learning the ultrasound, and then you'll be able to find the better system for you. About AE, I think that this is the amazing future, and in the future probably it will help a lot, even more than now. But I think that ultrasound is very related to the person who does ultrasound, because it can be very subjective, and sometimes you need a lot of things to think about to get some, to figure out what is going on with the patient. So I think that I can be something that can help in the future, but I believe in people's and the ultrasound. So it can help. So it can help you a little bit, but I don't want to do the ultrasound. This is not the future that I'm happy with.
Dr. Nogada has comment here.
There's something I wanted to say to everyone, and I think it's also enjoy the experience of learning MSK ultrasound. There are diagnoses that are pretty easy, meaning, for example, diagnosing a tenosynovitis is extremely easy. Diagnosing an abscess is extremely easy. Like superficial venous thrombosis is really easy. And these type of things are going to allow you to go through the process. It's not only you have to know everything before you start doing certain things on certain parts. So I think it's also important to realize that probably you're not going to know everything or feel comfortable with everything in your first day, but certainly you can start adding to your patient care from day one. And those things are going to make you feel better from day one. That's my point. Like, you don't need to go all the way to the whole experience before you get advantage from learning.
Yeah.
Question in the
Yeah.
back. Go ahead.
Yeah, I mean, I guess that's my question and comment. I mean, I'm a general pediatrician, late stages of my career, grandfather. If I followed the career path that you described, I would be about 3 years past retirement age before I started doing this routinely. So I guess I would say is do you see in all of this, gigantic realm of knowledge and experience, some high yield basics that you could teach the target audience, general pediatricians, sports medicine folks, that we can come out of a 2-day conference and really feel like we've gained like 3 or 4 really valuable high yield things that we could do in a straightforward way in our office.
Thanks.
Without a
$80,000 machine, like that would literally be my profit margin in like one of my offices is like a machine like this. So we're using very simple devices. We don't have focal points and things like that. We've got butterflies and so many other basic things. Do you see in all of this that there are opportunities?
I think throughout the remainder of the lectures today, I think you'll find some opportunities where you can apply it to your specific practice.
Great.
All right. Well, yeah, one final word.
So I agree that you will be able to do something when you come back home. Yeah, with something that you learn here. But there's an article out there which tells don't invest too much in systems. Invest in your learning curve. So it's important with the entry level machine and the good knowledge, you will see much more than advice. So invest in knowledge.
Yes.